Welcome back, everybody. Dr. Lee Coleman. This is not my twin brother. It's the same guy you've been coming to see, and I hope we'll do it for a long time. And one of the ways maybe we can do it a long time is because things just keep happening in the news that go right to the points that I've been making. Let's pick one. Is the president competent? And you may have seen in the news that legislators recently met with a psychiatrist who was representing other psychiatrists who had met through the auspices of Yale University and Medical School, Department of Psychiatry, Dr. Brandy Lee. And I caught her as she was interviewed on a news program. And what I could see was that we're considering taking one more spin of the wheel where we turn to our false prophets, our high priests of our society, the psychiatrists, to address questions because we're just too damn lazy or we don't want to think hard enough as to whether or not we have any business doing that. So the question is somebody competent? Let's even leave it out of the issue of whether this president is competent. The issue is, can psychiatrists help us with the issue of whether somebody is competent? And I've had a lot of experience with that for half a century as a psychiatrist. And the bottom line is psychiatrists don't know how to tell whether somebody's competent any more than they know how to do any of the other things that they're asked to do. In other words, if you remember, we've talked about past states of mind, reconstructing what they were like in the past for, say, a criminal defense, looking into the future, whether or not they might be dangerous. The evidence is very clear they don't know how to do that. Now we're talking about present, not past, not future, but present. And what happens when you ask psychiatrists to form an opinion about whether somebody is competent is, because they don't know how to do it with anything special, but you've asked them to do it, which gives them prestige, and you're going to pay them to do it, either because that's their job and they get a salary, or you're hiring them to do it, they're going to agree to do it in just about every case. So what are they going to do? They're going to get their costume on and they're going to rehearse the dance so they have a song and dance that makes it look like they know what to do. Now, I'm not saying they might not think they do know what to do. I'm not accusing them of being dishonest. I don't need to do that. The point is, it's not accurate, it's not legitimate that they can do it just because they have the song worked on and the dance worked on. So what are they going to do? What do I mean by that? They're going to diagnose the person. If they're going to think they might be incompetent, if they actually form that opinion for whatever reason. So first they're going to form the conclusion, like I said in the last session. Then they're going to make the diagnosis, which goes along with the conclusion. So if I think he's incompetent, I got to find a diagnostic label. There isn't any mental disorder by however you define it, whether you define it as a non-medical condition because we have no evidence that it's medical, or you get caught in the trap of psychiatry's diagnostic manual. Either way, it doesn't correspond with competence. Even the psychiatric mainstream will admit to that. They tell you, don't take these labels to imply any particular legally relevant anything that's legally relevant. So the question of whether the person is competent is going to get shoved into a framework of diagnosis and psychiatric sort of description, and abandon the legitimate question, is somebody incompetent? If you want to make it, is the president competent? Okay, that's one way, that's one issue. But the legitimate way you determine somebody's competence is first you recognize this is not medical. This is a matter of behavior, isn't it? How has somebody behaved? can they carry out the task that they either are competent to carry out or not competent? So if you want to investigate that, you investigate their performance. You study what the issues were, what was required to demonstrate competence, and then you study what they did. And I've been in countless cases where courts are asking for mental health professionals to determine whether somebody's competent, and nobody ever studied their actual behavior in the context of what it is that you were testing out. Whether it's competence to perform in a military, competence to keep state secrets, competence to drive a car, competence to raise a child, whatever it is. You investigate their demonstrated capacities in the context of whatever it is. But because we were waiting for psychiatrists to tell us whether they're competent or not, so it demonstrates we're not only not ahead when we ask the psychiatrist, but we're way behind the curve. We have failed to do what we would have done if we had not, so in such knee-jerk fashion, turn to a psychiatrist or some other mental health professional. And I can tell you that when people are found incompetent in legal settings where they have a possibility of being sent to confinement setting, they can be continued to be determined incompetent for the rest of their life based on these diagnostic labels. And it's one of the most horrifying situations. I never get over it when I can remember cases from 30 years ago. And I'm actually going to tell you one now. I said I wasn't going to give you some of these spectacular stories, but I will in this case. I have seen cases where somebody had been labeled 20 years earlier, schizophrenia in remission, and the label never gets dropped. Year after year after year, they're felt incompetent and not released. So this is a fraud on top of a fraud. First of all, the label schizophrenia doesn't tell you anything about any scientific determination. It's just a description of what somebody thought about their functioning, their mental state. Doesn't tell you whether they were competent or not. Then, by saying it's in remission, it's again fake medicine. In remission is a term we use for a medical disease, let's say cancer, where the treatment has been successful enough that clinically, in terms of how they're doing, they're very, very much improved, maybe without symptoms. So you say the disease is in remission. It doesn't mean the disease is gone. And you have a way of knowing if it's gone, then you say the disease has been cured. But if it's still there, but it's not part of the clinical course, there's no symptoms, you can legitimately say it's in remission. How do you have something be in remission when you're never able to demonstrate that it was there in the first place? Which is what happens with mental disorders or behavioral disorders or tests of one's ability. How do you demonstrate your competence when you're housed in an institution and you're not allowed to take care of yourself? So, without going on any longer, let's go back. We were talking about, what do I think? What does it mean for legislators to be going to psychiatrists and asking them about the competency of the president? It's all baloney. It's all nonsense. If we go down that road, we'll be further entrenching psychiatry in this illegitimate role that it's playing in our society. No matter what you think of President Trump, don't let that take you down that road. We will pay the price, I promise you, as a society, as long as we keep doing that. In this discussion of the president and the recommendation by some psychiatrists that their opinions about his competency would be useful to the nation, and legislators meeting with psychiatrists on that subject, it's certainly a question that I know is going to continue, despite whatever I say in our meetings, that if the situation is scary enough, don't we need to have a way to examine with psychiatrists' methodology whether or not a president, whoever he might be, is have a mental disorder which would infringe upon his competency. And the answer, in my opinion, is no. Because no matter what's going on politically, it doesn't mean that the psychiatrists have an ability which they don't have. And if you find a dishonest method to accomplish a goal, no matter how laudable it might seem, history tells us that you will not be happy with the result. Psychiatrists don't have any way to determine competency. They will use methods which do not, in fact, are not reliable, are not helpful because they're just not based on what we can do. We need to resist the temptation to turn to people who don't have the genuine skills to do it. Most of all because the process of turning to them takes away our energy from the real issue is, how do we determine such questions? And if the current method, the 25th Amendment, by which the cabinet, the vice president, if that isn't a method that we like, then that can be changed. That's not by bringing in people who have a supposed expertise that doesn't exist. Because in the process of doing that, we are validating their presence in issues which will then haunt us for decades and centuries to come, which is exactly what has happened by bringing in psychiatry as a legitimate part of medicine for skills that it doesn't have, and we've already seen the price that we are paying and will continue to pay. So I say, resist the temptation to bring in false prophets. Stick with the task according to valid principles. In this case, if the Constitution needs changing on the issue of competency of the president, then let's get busy and change it. I'm not taking a position on that. I'm telling you, I'm taking a position on the role of psychiatry, and it should be 0. Thanks for coming.